Today I'm going to show you how the CIA and the FBI can take a perfectly normal human being and install multiple personalities.
What the hell you say?
Can this really be done? Yes. I would not recommend that you do this if you don't have any kind of training. I would not recommend that you do this if you don't have any experience in psychology or in therapy or in clinical practice of some kind, because it can be dangerous. Let me start with this. You must begin with the correct person. This does not work on everybody. In a minute, I will tell you who it won't work on, but first let me tell you who it will work on. That is somebody who is highly suggestible, somebody who is easily led, and someone who buys into things pretty quickly. Let me tell you very quickly who this will not work on. Generally speaking, not with everybody, but in a very general sense, these things will not work with someone who is in what's called the cluster A of personality disorders. For the most part, this would be paranoid, this would be schizoid, and schizotypal. In addition to that, people that are in certain places on what we call the autism spectrum, this will not work on either. Let me very quickly tell you why. Because in all the cases that I just mentioned, whether it's cluster A or whether it happens to be someone who's on the spectrum, more often than not, there is what's called hypervigilance in what is called the dorsal medial prefrontal cortex. It sits right here in your forehead. One of the things that it does is to be very concerned about anything that needs to be concerned about. And if you look at cluster A personality disorders, generally speaking, paranoid, schizotypal, or schizoid, they are very commonly very concerned, very nervous, and this is because the dorsal medial prefrontal cortex is always on. And as long as it is on, your mind subconsciously is constantly looking for anything that needs to be worried about. And because of this state of hypervigilance, you can generally not hypnotize people like this, and you certainly will have a very difficult time, if it's possible at all, splitting a personality in someone like this. People generally fall into one of these four categories. There is a category that is called easily led, and that's just under 26% of people. There's another category called able to be persuaded, and that's just right around 36-37%. Then there is the people that are unable to be persuaded no matter what you do. These people are generally very skeptical, and that's the worst type of person that you could ever try this on because it won't work. And that is roughly between 28 and 30% of people. And that leaves one spot in particular, and I've called this one the absolute yes. And this is roughly 9 to 10% of the population. The way that it works is this: the people that fall into this 10% category, these are the people that will buy anything that you want to sell them. They will believe any story that you tell them, and they will always give you the benefit of the doubt because they want to believe you. If you're a door-to-door salesperson, these people are your dream, because no matter what you're selling, as long as you're convinced that they need it, they're going to be convinced that they need it. And then what's called the easily led category. These are the two categories that, for the most part, are the people that are susceptible to, one, hypnotism, and two, having their personality split. So how is it done? First of all, you take someone who fits in one of those two categories and you bring them to a place that they've never been to. This could be a place where you say you're going to do an interview, or you just want to speak with them, but you want to have a conversation. So what you're doing is you're changing what they're accustomed to seeing, and this creates what's called novelty. What you're doing here is you want someone to not be in familiar surroundings. Once you've got them here, you need to start a conversation with them. And because these people fall into the easily led or absolutely yes category, they are going to be willing to talk to you. Now, in this conversation, you want to ask basic questions that almost everyone would answer yes to. And one of them would be like this: have you ever felt that there's a part of you that really wanted something that the other part of you did not want? You can give them an example. Maybe there's a part of you that in the middle of the night, you're really hungry and you're thinking about getting up and eating something that is terrible for you. But the other part of you says, no, we're going to override that because that's not good for us. Or another example would be, there's a part of you that desperately wants something that's unhealthy for you because it tastes good and it feels good. But the other part of you that's a little bit more wise says, no, we are not going to do that. This in and of itself will cause almost anyone to agree with you. They will say, well, yes, of course. I think everyone has had that. Now, once they've agreed with you, you take the next step, which is you ask that person to think about if you could give that other part of you a name, what would it be? And you let them give it a name. And now what you do is that you say to them, I would love for just a minute if you would have a conversation with that part of you that you repress, that part of you that wants to do the things that you stop it from doing. If you could have a conversation with that person, what would you say to them? And then let them speak. And they will become more comfortable with the idea that there is an alter ego, that there is a different sort of personality maybe, or a different type of an awareness within them that they've given a name to. Now, once you've done this, you don't want to do everything at once. You might want to give them a break and maybe meet with them a few days later or the following week. And then you pick it up right where you left off. You get them to acknowledge that there is a part of them that wants things that the more wise part of them will always say no to. And because they're easily led and because they generally want to say yes, they will truly believe that they're having a conversation with that alter ego. So you continue the conversation. Now, this could go on for up to a few weeks. This could go on for a couple of months. But what you're doing is you're building trust with that person. And what they begin to see is that you are the avenue with which they can have a conversation with that part of them that wants to overeat, that wants to drink too much, that wants to stay out too late. Either way, what you're doing is little by little, you're creating a split within that personality. Now, when you get several weeks into this, depending on the person, maybe a month in or so, they will have trust in you. They will believe that you've showed them how to communicate with the part of them that wants things. And so what happens is they begin to refer to this person, remember what I said earlier, by a specific name. And now what you do is you begin to pull them apart. Now what you're asking them to do is to have a full conversation. If you could close your eyes and you could say anything to this other person, which is their alter ego, and you could say just about anything you want about any activity that you've ever been a part of, or maybe even a memory that you're foggy about, that you're unclear about. I want you to close your eyes and have a conversation with them and see what they say. Now, at this point, the subject will truly believe that the other alter ego that has a different name is a different person. And once again, because they're easily led or because they're in that absolute yes category, they will want to believe that it's a separate person. Now, in my next video, I'm going to show you what the trigger is that you can use to unlock that so that at any time you want, you can have that person jump into the other personality. But that's something for the next video. Remember what I said at the beginning. Do not do this unless you have some sort of experience in psychology and therapy and clinical practice, because you need to know what you're doing, because when you do this, you are literally taking one person and turning them into two. I'll see you in the next one.